Hi, family. Welcome back to my channel. So, if you just joined my live, please don't forget to click the like and subscribe button. So, in today's topic, we are talking about postpartum recovery. So, postpartum recovery is the day you deliver a baby for 6 weeks. So, these are the days that you need to you are to recover from any wound or any injury that you had during your childbirth. So the 6 weeks is either you had a vaginal delivery or you had a C-section. So whether you had a vaginal delivery or a C-section, the postpartum recovery is 6 weeks. But the fact that it's 6 weeks does not necessarily mean that you should heal in that 6 weeks timeline given. No, especially if you've had a C-section. No matter if you had a C-section or a vaginal delivery, you can still take a long time to recover. It all depends on you and how your childbirth was. So, for instance, I think I took about 8 weeks or more to recover because I don't want to go there right now. So, the moment you've been waiting for is finally here. You've been dreaming, you've been so anxious, you've been so anxious to meet the little one. You've been so anxious to come out of pregnancy already. You're already tired of pregnancy, and then you deliver your baby. From the day you deliver your baby to 6 weeks, it's postpartum recovery. That is the timeline given. I don't know if it's scientifically or but that's the traditional way or the timeline given traditionally to heal from anything that you went through during childbirth and any wound that you had during childbirth. This is the time that you're given to heal. So if you just joined my live, thank you so much for joining. Thank you very, very much. Please don't forget to like and subscribe and also to share this live with a friend or a loved one. So I've listed everything down here. I'm going to mention them. So postpartum recovery, how long you to recover from birth shouldn't be or it shouldn't be something that you should really worry about. If you want to take a year or 6 months or 4 months or 5 months to recover, that's cool. But traditionally, postpartum recovery is 6 weeks. If you've had a vagina, perineum, or a C-section, incision should be healed, and your uterus should be back to its normal size in 6 weeks. Throughout those first weeks, you will experience a lot of changes from new levels of tiredness to hormone fluctuations. And you will also have the initial 6 weeks of recovery. For example, if you've developed varicose veins during pregnancy, it may take up to 12 weeks for them to fade or go away. Like if you had varicose veins in pregnancy, you might. Okay, so when I was pregnant with my fourth, all my pregnancies, I've never experienced stretch marks, varicose veins, or whatever. But with my fourth pregnancy, I had varicose veins in my thighs. And like it's saying here, you will get, sorry, it will fade away. The varicose veins and everything will fade away within 12 weeks. And it's true because around 10 weeks, I discovered that the varicose veins were fading away, like it vanished around 10 weeks. So if you've had varicose veins and all that, it will take about 12 weeks for you to for you to recover from your postpartum. So the postpartum is traditionally 6 weeks, but it all depends on you, the woman who have given birth. That will all really depend. That will also say a whole lot about how long you are going to recover. Some would take about 6 weeks, like all my other childbirth. Like I take about 2 weeks and I recover. People be even asking, "Are you really sure you've given birth?" Because I look nothing like someone who have given birth. I'm so strong and going around everything. Like when I deliver and I get home, the very day I get home, I can cook, I can clean, I can wash, I can do anything. So it will all depend on you, the human, how long you are going to recover. this is how your body will feel and how your body will change after you give birth. That's the postpartum hormone changes. Hormones are your body's chemical messengers that tell your body how to do something and when to do it. During pregnancy, your hormones change to help support your growing body and prepare your body for giving birth. After giving birth, your hormones are on a new mission to help you heal, bond with your baby, and breastfeed your baby if you choose to breastfeed your baby. So, the first postpartum hormone changes your body will go through are one, oxytocin. Oxytocin, known as the bonding hormone, surges and contributes to the strong parental instinct you feel. This is very, very beautiful and natural. You feel that the oxytocin is natural to happen after you delivered your baby. That's when, if you don't feel any of this, it might be a postpartum depression because you will feel this naturally after you delivered your baby. The oxytocin is known as the bonding hormone. This is the bonding hormone that you will experience after you've delivered your baby. No matter how you had your baby, whether you had a C-section, whether you went through some stressful labor and delivery, it is very natural for you to feel the need to bond with the baby. It's a natural feeling. And if you don't experience any of this, you might be going through postpartum depression. That's when you don't even feel like bonding with the baby. Like when I had my baby, I was in a shock. So the first 3 hours, I couldn't bond with the baby. I was just so still, looking at the bulb. Like everything felt like very strange to me. But very soon, I snapped back and I was able to connect with my baby. Although the shock comes and go, I was able to recover from it. So the other one is and progesterone levels decrease when your baby and the placenta are delivered. After the placenta is delivered, your estrogen and progesterone levels decrease. And the third one is prolactin, which increases to signal milk production, which is also very natural. All my four pregnancies, I think the only childbirth that my breast milk came faster was my fourth one. All my other kids, I think my first one, it took about a month. My second one, 2 weeks. My third one, I think about a week. But this one, it's immediately came after I delivered my baby, and it's very, very amazing. Very amazing because I just wanted to breastfeed her. I think this pregnancy, my breast milk was really producing when I was pregnant because my breast became very, very huge and full. So it's not really strange that my breast milk came that early. So the next one we are going to talk about is bleeding and vaginal discharge. Sorry. So the bleeding and the vaginal discharge, as your uterus sheds that thick lining it's maintained during your pregnancy, you will experience some vaginal bleeding and discharge, which is known as lochia. Even if you had a cesarean section or a vaginal delivery, you will experience this bleeding and discharge. Lochia will start out as bright red or a day or two before gradually fading to pink, and then light brown or light yellow. Bleeding and discharge will be the heaviest within the first several days after having your baby, but will become lighter as time goes on. Typically, lochia can last 4 to 6 weeks, with discharge naturally decreasing. Okay, so this one too is also very natural. It's very natural for you to start bleeding after you've had your baby, which is called lochia. And I think I also, my first, third pregnancies, within a month, it fade away. But this one, it lasts for about 3 months. This baby, I think I bleeded after I had a baby for about 3 months. Not really bleeding like very, very thick bleeding like menstruation. In the beginning, it was like that, but about a month, it started fading. It started getting light. The color started getting light and it wasn't as heavy as it started. and then it finally went within 3 months. So all my other pregnancies too, it wasn't like that. Like I bleed for just a month and it was gone. Sorry. So let's go to how much bleeding is too much when you've had your baby. After you deliver your baby, how much bleeding is too much at this stage? So early on, it may seem like you're bleeding a lot, similar to having a very heavy period, like I said. This is totally normal, but there are a few signs to watch out for after you deliver a baby, which is normal and which isn't. If you are soaking through one pad an hour for more than 2 hours, call the nurse line or call your healthcare provider. Like if you use one pad for just an hour and your pad is wet at this stage, then I think you should call your healthcare provider. But when I gave birth, I think I stayed in the hospital for 3 days, and the maternity pad we use in Ghana here is not that heavy. It's very light. It's very easy for it to. It's very heavy, very light for the bleeding. So it's very normal because I was changing my pad within every 2. I think before I left the hospital to Confanochi Teaching Hospital, I was already prepared for a C-section, which I denied. So I was even injected for C-section. It was when I arrived at Confanochi that I discovered I was injected for a C-section because I saw a woman who have also had a C-section and she was given the same injection that I got. That was when I realized I was already prepared for a C-section. But I denied the C-section and I went to Confanochi to have a vaginal delivery. So if you're soaking through one part an hour for more than 2 hours, call the nurse line or care provider right away. If you continue to have bloody discharge or past blood clots for more than 4 weeks, call your healthcare provider as well. Increased bleeding after your low starts to decrease can be a sign you are overdoing it and need more rest. Yes, if you are overly stressed, it's normal for you to start bleeding. There are times that as a woman, even when you hear a shocking news or if you stress yourself so much, you may bleed just a little, like a light bleeding, like spotting. So if you stress yourself too much after you deliver a baby, you need a whole lot of rest. This is the time that you need to rest a lot. Resting can also help to produce breast milk. If you are overly stressed, it's very difficult for you to produce breast milk. Hold on, guys. Please hold on. I need to do something. Sorry. So you're not perineum soreness. Both vagina and your perineum, the area between your vagina and your rectum, feel very tender and sore from the strain of childbirth. That is still very normal. After you deliver your baby, your vagina perineum, which is the area between your vagina and your rectum, become very sore. Like when it becomes very sore, it looks a bit bigger than the usual size after you deliver your baby, which is very normal. If you gave birth vaginally, it will probably take you a few weeks to heal, especially if your perineum tore or you had episiotomy, if you labored or pushed at all. But eventually, if you gave birth by C-section, it's very likely that you will still be sore. Your vagina perineum will be sore. And if you had a vaginal delivery too, it will be sore. It will be much bigger than the usual size, but it will heal eventually. And after birth pains you feel after pains you feel after birth contractions. Contractions after birth, also called after birth pains, might be uncomfortable at times, but nothing like what you may have experienced during labor. pain after contraction, contraction pains after childbirth. So my first two girls, I never experienced this. So with my son and my last born, I experienced this. But no, sorry, with my son, I experienced it. But my last born, I think I experienced it when I was in the hospital. But when I came home, it's faded away. But with my son, it took a whole lot of time before it faded away. Especially when I'm breastfeeding, the pain was so unbearable. But it cannot be compared to the pain you go through during labor. That one is unmeasurable. It's unfathomable. That pain is, you cannot compare it to any other pain. Only experienced people understand. If you're a man, you may never understand it because you've never go through what we go through as women. Okay. After birth, contractions help reduce uterine bleeding and help shrink your uterus back to its usual pre-baby size. You may notice after birth pains that you may notice after birth pains the most if you breastfeed. You may notice that after birth, pains increase the most if you breastfeed. Like I was saying, I experienced this with my fourth one. Like if I'm breastfeeding, the pain was so unbearable. I couldn't contain it. But it cannot be compared to the pain I went through during labor. This is because breastfeeding causes your body to release oxytocin, a hormone that causes uterine contractions. In here, we'll be saying that wawodian epe baby akwa akoda. In Africa, here we say that wawodian no epe baby akwa akoda. Eniti ene na moyem sa enya baby da etobetwa. And in Africa, they have other remedies for that, which is apetishi. I think so. When I had my son, I went through a whole lot of pain, and I was recommended to drink apetishi, which I drank, but still it never faded. The pain was less after I took the apetishi, but it never stopped it from coming. Then it eventually stopped. And another one is after birth, contraction help reduce uterine bleeding. I think I've already said this. And help shrink your uterus back to its usual pre-baby size. You may notice after birth pains the most if you breastfeed. This is because breastfeeding causes your body to release oxytocin, a hormone that causes uterine contractions. Your breasts have been changing since the beginning of your pregnancy and around firm, swelling, and sore. These are all normal symptoms. These are all normal signs that. So I'll do a whole video about guys, my connection is very bad. I don't know if I should stop and continue later. And my battery is also running down. So we will end it here, and I'll do a whole video about that. But it was just left with something small. So sore or cracked nipples. Let's talk about that. Blood flow to your nipples increases throughout your pregnancy. So you've probably noticed some tenderness for several months, but the first few days after giving birth brings that blood flow to a new height, making them particularly sensitive. And naturally, if you have chosen to breastfeed, that will have an impact too. As your baby learns how to properly latch on your breast, it's common to experience a little pain at first, but once baby gets a good latch, this is when your baby is beginning to learn how to latch well, and that will be very painful, trust me. That go away. A little discomfort as a baby gets into a rhythm is normal. Yes, that's a sacrifice you have to make, but feeling constant pain throughout your feeding is not. So if you feel constant pain throughout your feeding, you should call your doctor immediately. So please, we will end here, and please thank you so much for watching, and thank you for liking. I love you guys so much. So I'll see you all in another one. Bye.